Parkinson's disease, those who advance to dementia, by Catherine E. Blackburn. When nurses think of Parkinson's disease, we think of a movement disorder. However, many diagnoses also describe a slowness in thinking, attention span deficits, and a loss of memory. Problems with memory and thinking that begin to interfere with the independence and quality of life are referred to as dementia. According to Mack, dementia may develop in later stages of cognitive symptoms, followed by motor symptoms. This is caused by a significant loss in brain function. This type of dementia leads to a tremendous impact on social and occupational functioning as it attacks the problem-solving abilities and mood of the patient. The basis of this presentation is to educate nurses on the second most common neurodegenerative disorder, first by discussing the pathophysiology of Parkinson's dementia, and then reviewing the clinical presentation, assessment tools, and diagnostic availabilities. Arslan and Kurtz agree that at least 75% of Parkinson's disease patients who survive greater than 10 years will develop dementia. Davis notes that dementia is relatively rare in people with onset of Parkinson's disease before 50. So, according to recent studies, the prevalence of dementia and Parkinson's disease is close to 30%, which is an increase in 4 to 6 times compared to the controls. Most studies are showing that African Americans are less likely to have Parkinson's dementia than Caucasians. It's diagnosed most commonly in men, actually 1.5 times more likely. The mean age is 70 years old, with an early onset defined at age 50. 10 million people worldwide have Parkinson's disease, with over 69.6% are affected by dementia. Dementia had a greater likelihood of death. Two main risk factors for Parkinson's dementia is age and genetic disposition. Advanced stage of Parkinson's disease, being male and having visual hallucinations follow severe motor deficits tend to be prominent risk factors. Researchers have also linked environmental factors such as exposures to herbicides and pesticides. They've also decided that contributing factors can be smoking and hypertension. Pathophysiology of Parkinson's disease is basically the death of dopaminergic neurons. Proposed mechanisms are protein agitation in the Lewy bodies, disruption of autophagy, changes in cell metabolism, neuroinflammation, and blood-brain barrier breakdown resulting in vascular leakiness. Causes to the part of the brain that controls movement at first, and then if it doesn't go away and continues to get worse, the progression eventually deteriorates the part of the brain for mental functions such as memory and thinking, according to Parkinson's Disease Dementia Leaflet 2019. Disease progress into dementia symptoms are beyond tremors and movement deficits. First, trouble focusing, remembering things, and loss of making reasonable judgments are noted, typically by family members. A hallmark presentation of Parkinson's disease dementia is the attention rather than memory characteristic. This can still be present for a while. Slowly, symptoms of depression, anxiety, and even irritability become present to the family, and then later stages, hallucinations and sleep disturbances are common. A patient can suffer from this presentation from 5 to 7 years as the disease causes their quality of life to continuously decline, according to Mack. The criteria for assessment tools to accurately diagnose Parkinson's disease dementia is guidelines that were set up by a task force from Movement Disorder Society. The primary feature is that established Parkinson's disease first, and then the dementia develops. They use the Queen Square Brain Bank criteria to diagnose Parkinson's disease before dementia develops. There's currently no diagnostic test. The combination of clinical findings and reported symptoms a patient is experiencing is the basis for Parkinson's disease dementia. In conclusion, Parkinson's disease dementia is a dementia that is associated with Parkinson's disease. It is prevalent in men greater than women over 60 years old, along with motor function deficits. Cognitive function begins to deteriorate. Research has shown that Parkinson's disease is a death of dopaminergic neurons. Clinical presentation and patient descriptions of symptoms is the basis for diagnosis. There's no cure. However, there's medication to help control the symptoms. A debilitating disease that truly takes a person's life. As Psalms teaches us, do not cast me away when I am old. Do not forsake me when my strength is gone.